Today, we're diving into a really high-stakes medical decision. It's about the main arteries in your neck, a major cause of strokes, and this incredibly tough choice between just taking medication or going for a pretty risky surgical fix. Okay, let's get into it.
It sounds a little strange, right? But honestly, it's the perfect way to think about this. Imagine the main highways that carry all the essential supplies to your brain suddenly getting clogged up, creating a massive traffic jam. That is pretty much exactly what we're talking about with a condition called carotid artery stenosis.
So here's the deal. Over time, things like smoking or high cholesterol can cause this fatty gunk, called plaque, to build up on the walls of your carotid arteries. And as more and more plaque builds up, that passageway for blood gets narrower and narrower. And that's the dangerous traffic jam we're talking about.
And listen, this is not some rare, obscure problem. This dangerous narrowing is the culprit behind about 10% of all strokes. That's a huge number. So figuring out how to diagnose and treat it is absolutely critical. Which leads to the question, how do doctors even find this hidden threat?
All right, so let's get into how doctors actually find this blockage. They've got some pretty amazing tools that let them see right inside your arteries without ever having to make a single cut.
The process usually starts right here with a simple, non-invasive ultrasound. It acts like a first look, a screening test. Doctors can see how the blood is flowing and spot any areas where that flow seems turbulent or restricted. That's a huge red flag for a potential blockage.
Now, for a much clearer picture, the next step is often a magnetic resonance angiography, or MRA. And you can see from the image just how much more detailed and high contrast these pictures are. It gives doctors a way better look at the actual structure of the blood vessels and the plaque itself. But when they need the absolute highest level of accuracy, they turn to what's called digital subtraction angiography, or DSA. This is considered the gold standard. They inject a special dye that basically lights up the arteries, creating this incredibly clear roadmap. It pinpoints the exact location and, most importantly, the severity of the blockage.
So once the problem is confirmed, the big question becomes, what do we do about it? And this brings us right to the heart of the dilemma, because there are two very different paths you can take.
On the one hand, you have medical management. This is the first line of defense, especially for people who aren't showing any symptoms yet. We're talking about powerful drugs like statins and antiplatelets, plus lifestyle changes. But on the other hand, if a patient has had symptoms or the blockage is really severe, surgical intervention is the gold standard. This means either a carotid endarterectomy, a surgery to physically remove the plaque, or putting in a stent to prop the artery open.
That seems pretty straightforward, doesn't it? If the blockage is bad, you just go in and fix it. But, well, it's not nearly that simple.
Because going in to repair that artery, especially with the more traditional surgery, the carotid endarterectomy, comes with its own set of very serious and sometimes even life-threatening risks.
First up, there's the risk of a heart attack. The stress of any major surgery can take a massive toll on the entire cardiovascular system.
And while you might look at that number, 0 to 2%, and think it seems small, believe me, when it happens, it is an absolutely devastating complication.
Next up is something called a post-operative neck hematoma. This is internal bleeding in the neck, right where the surgery was done. It sounds localized, but it can be catastrophic.
It happens in about 3.4% of cases, and it's a critical emergency. Why? Because the swelling from the bleed can actually compress the windpipe and abruptly cut off a patient's ability to breathe.
Then you have the risk of damaging the incredibly complex web of nerves that run through the neck, right alongside the artery that the surgeon is trying to fix.
This happens in about 5% of patients. That's 1 in every 20. And we're not talking about a minor issue here. The consequences can be significant and totally permanent.
I mean, just look at this list of what's at risk. We're talking about the nerves that control your tongue, your voice, your face, even your ability to swallow. Damage here can dramatically impact a person's quality of life.
And here we have the most profound risk of all. The very procedure designed to prevent a stroke can sometimes cause one. In the first 30 days after the procedure, the risk of stroke or death for the traditional surgery, the CEA, is 3.2%. For stenting, it's nearly double that, at 6%. This just underscores the immense stakes of going in to intervene.
So, with all these risks on the table, how do doctors and patients possibly make a choice? Well, the entire equation, the entire debate has shifted dramatically in just the last few years. Just look at this.
In the past, the annual stroke risk for a patient with this condition who wasn't showing symptoms was over 2%, even on medication. But with modern statins and drugs, that risk has plummeted to less than 1%. Medical management has gotten so good that it completely changes the entire conversation about surgery.
And this quote from the research really hammers the point home. For a surgeon to even justify operating on a patient who has no symptoms, the combined risk of the surgery and any future strokes has to be less than 0.5% per year. That is an incredibly high bar to clear.
Which leaves us with this really powerful question. This isn't just about one artery. It's about a fundamental shift in all of medicine. As our ability to manage chronic diseases with just medication gets better and better, the line between a helpful intervention and an unnecessary risk becomes finer and harder to see. It's the surgeon's dilemma, and it's a question that doctors and patients now have to face together every single day.